You're listening to Health Talks from the Inside Out. I'm Dr. Andy Russell, the Chief Medical Officer at Williamson Health.
Dr. Andy Russell, our Chief Medical Officer here at Williamson Health. Thank you for joining me today on the podcast.
You're very welcome. I'm glad to be here.
So I'm beginning these conversations asking what initially drew you to medicine?
I'm one of four siblings, so between the four of us, there's always somebody hurt, somebody fallen, scraped knees or elbows, somebody was bleeding, and I was always the one who wanted to go over and be involved and just kind of see what was going on. And as I got older and into junior high and high school, I loved the science classes. I loved dissecting things and was just fascinated again by the human body, by the resilience of the human body, the complexity of it. And so that's kind of what led me to a career in medicine.
Yeah. And what about emergency medicine? Because that's your specialty. I know when y'all are going through med school, you kind of rotate through the different specialties. What was it about emergency medicine?
Well, going through school, like you said, we rotate through all the different specialties. And going into medical school, I thought I was going to go into pediatric surgery. And as I rotated through surgery and OB and internal medicine and pediatrics and OB/GYN and the other fields, I realized I like all of those. And the ER allowed me to do a little bit of everything. We're still doing some procedures, not the big complex surgeries that I thought I might be doing my entire career. But again, you get to do a little bit of everything. I'm taking care of people on a long-term basis sometimes. We actually delivered a baby in the emergency department yesterday, but those things happen.
Yeah.
And so the emergency department just kind of allowed me to satisfy all those cravings, all those needs, where I liked a little bit of all the different areas of medicine. And so that's what we see every day.
Yeah.
The fun thing to emergency medicine, from my perspective at least, is the variety. People always ask me, oh, you must be an adrenaline junkie, or you like that high of all the action. And that's not necessarily the draw for me. It's really more the variety. No 2 days are the same. You never know what's going to come in the door next, so you have to be prepared for anything. And so that's the exciting point and the thing that I love the most about being in the ER.
Yeah, I'm so excited about this episode.
Mm-hmm.
I have so many questions. We're going to go deep. But I did want to first hit on you being Chief Medical Officer, because that is another role. You're still practicing in the emergency department, but you are our Chief Medical Officer. So can you give me a quick overview of what that means? What does that role entail?
In my role as the Chief Medical Officer, I have oversight of all clinical operations within Williamson Health. And I tell people it's 180 degrees different than my regular job in the emergency department, but at the same time there's similar priorities. Number one is always what's best for the patient. If I'm in the ER, I always think, what is the best for this one patient I'm seeing right now? In my role as Chief Medical Officer, it's what's the right thing to do for the patients, the community, and what can I do to improve medical care for everybody here? Now that means days are different every day, much like the ER. But again, it's working with lots of different people to provide the best care we can for our community.
And how long have you held that position?
I'm in my 9th year currently as CMO.
Okay. And for listeners who might not know, can you give a basic overview of our medical staff?
Gosh, I've been here for over 22 years now. And we've grown, probably tripled in size since I started. We are now up over 900, I think almost 960 providers. And that's a combination of physicians, nurse practitioners, physician's assistants, CRNAs. But yeah, we're rapidly approaching 1,000 providers on staff just as the health system has continued to grow.
And you mentioned advanced practice providers, and I do think that's an important point to make for our listeners. So when we talk about our med staff, the vast majority is physicians, but we do have some of those APPs, mid-levels sometimes, what they're called, which are those nurse practitioners, physician assistants, CRNAs, and that type of thing.
Correct. They function as physician extenders. They help allow the physicians to see the more complex cases, but they can provide invaluable care to patients. The industry as a whole is gravitating more and more to these APPs, and there's such a shortage of physicians already. Having more advanced practice providers on board with us just help provide better care to more patients.
So sometimes when people hear us refer to our providers, just know that means collectively our medical staff, our credentialed providers, which are physicians and advanced practice providers.
Correct.
And what about the composition of our providers, of our medical staff? So let's talk a little bit about, we have some employed, some are not employed. Give us that landscape.
About 160 of those providers that you mentioned are employed by Williamson Health. That's part of Williamson Medical Group, that's Bone and Joint Institute, that's our hospitalists, and our hospitalists are only here in the hospital taking care of the inpatients. But that's also a mix of providers that are employed by, say, Vanderbilt, or we have Ascension employees that are on staff here. We have several independent practices, and their providers are on staff here. So again, we are an open medical staff. Anybody that meets the requirements to be on staff and goes through the proper channels and fills out an application, they can have privileges here as well.
Yeah. And I do love the collaborative nature of our medical staff, because even though at the end of the day, some of them might be technically employed by other people, everybody feels like they're just Williamson providers, and everybody is all in here and just collaborates really well.
Yeah, that's exactly right. I mean, I'll use cardiology as an example. We have cardiologists that are employed by Vanderbilt. We have another group employed by Ascension. They cross-cover each other's patients at times when needed. They work very well together. They make schedules along with each other. They work great with our emergency department and our EMS. But and it's not just cardiology that works well together. It really is the entire staff. Regardless of who signs their paycheck, they're Williamson Medical Center doctors.
Right. And it's fairly unheard of to have a medical staff this large, right? For a hospital our size, to have that many providers. And largely we hear because it's a lot of the providers live in Williamson County and they want to practice here as well.
Yeah, you're exactly right. For a hospital our size, I would expect our medical staff to be less than half of what it is. But again, I think that's a testament to the hospital itself, along with the community. Like you said, a lot of those physicians might be employed by bigger health systems based in Nashville, but they live here and they want to take care of their patients and their neighbors and their friends and family here where it's convenient for them.
Yeah. So of those 960 plus providers, how many specialties are they covering?
So we do have over 60 specialties represented on our medical staff here. We do the vast majority of things that they'll do in the bigger hospitals, like cardiology, GI, pulmonary. We have a NICU. Of course, some of the things we don't do include trauma and open heart surgery, but as the community continues to grow and the medical needs of the community continue to grow, we will continue to evolve to meet those needs.
Yeah. So from a leadership perspective, what are some of the main initiatives or principles that you are focused on as our Chief Medical Officer?
My top priority in this role is improving patient safety and care quality. Over the last couple of years, we also were focusing on the patient experience. In this community, there's so many great places you can receive medical care. What can we do to make this a place where not only do you get great medical care, but we make it more comfortable for the patient and their family? Again, from the Chief Medical Officer's perspective, my number one goal is to make this the safest place to provide care, and that's something our entire medical staff focuses on. What can we do to provide great care and in the most comfortable setting for the patient?
In case listeners haven't heard Dr. Brad Bullock's recent podcast episode, he talked all about our efforts regarding high reliability and our focus on patient safety. It was really interesting.
Yeah, that's a big focus of the entire system now. We've sent several of our hospital leaders to conferences so we can become a more highly reliable organization.
So hearing that you are an emergency medicine physician, what all does that really encompass?
So being an emergency medicine physician, I went through emergency medicine residency just like your kids' pediatricians went through a pediatric residency, or your general surgeon went through a surgery residency. So you finish your 4 years of school, you do a 3 to 4 year residency program, then you take your board exams and you're a board certified emergency physician. One of the things that I think helps our emergency department stand out, especially over the last 20 years, is that all of our providers are board certified emergency providers. In the past, when I was coming out of residency and interviewing at jobs, not every hospital could claim that all their doctors were board certified ER trained physicians. That's getting to be more and more the norm now, especially in a major area like where we are. But there's still some hospitals that don't have board certified ER doctors providing emergency care.
Yeah, that's great. And can you spend a few minutes talking about, we actually have 2 separate emergency departments, one for adults, which is where you work, and then one on the pediatric side. So can you just make sure you give an overview of those 2 different services that we offer for the community?
Sure. So yeah, back in 2015, we opened our separate pediatric facility, including a pediatric emergency department. We partnered with Vanderbilt Monroe Carroll Jr. Children's Hospital for that. And so the pediatric emergency medicine physicians that are there are all trained in pediatrics and emergency medicine. So they have specialized training just for that patient population. But you would see different providers. If you're 17 years old, you'll see the pediatric side. When you come back after you're 18, you would come to the adult side. But they're right there next door to each other. But you'll get the same high quality care from the pediatric emergency trained providers that you would on the adult side.
Right. And it really is a blessing for those families that have the children to have a completely separate place where they're waiting, and even the rooms that they go back to are all child focused and family friendly.
It's much more kid friendly. They have a child life specialist there. They do simple things that it puts the child at ease while they're there being a patient. And that's, if my child needed an emergency department, I would want them in a pediatric specific facility.
Yeah. And 8 beds there?
Correct.
8 beds in the pediatric emergency department. And then how many beds over in the adult?
We now have 43 beds in the adult emergency department once we finished our expansion project a couple of years ago.
And if people haven't been to the adult emergency department since the renovation, it really is amazing.
Yeah, we are very lucky with the new facility that we have. The rooms are larger, the waiting room is much larger, and again, a lot of that goes back to the focus that I mentioned earlier on the patient experience. When you come to the ER, that's never a good day for the patient. So we're trying to make this as comfortable of an experience as we can.
So let's talk about the overall process from when somebody either comes through the door to the emergency department, or we know that some people come by ambulance. But let's talk about what is that process, getting checked in. There's some waiting time in the waiting room, triage, getting back to a room. How's that whole flow work?
Well, it's different throughout the day depending on the volume of the ER. In a typical situation, a patient would come through the front door. They would briefly sign in just with some brief demographic information so we can start getting you registered at the computer. There'd be a very brief triage exam done by one of our triage nurses, and then you're taken back to an exam room where you can see one of our doctors.
And we say triage a lot, but break that down. What does that actually mean in case someone doesn't know what that term is?
So our triage is our intake center where you'll first be seen usually by a nurse, although it can be a nurse practitioner or a PA at times. But they'll do just a very brief exam, ask some questions, check some vital signs. That way, if there are multiple people waiting, we can determine who is the sickest, who needs to be seen first. Unfortunately, at times, you might be sitting there and other patients are coming in and they get taken back to be seen before you do. Again, that's our triage nurse who has extensive training in determining who are the sicker patients that need to be seen first, and it helps us prioritize those patients.
Yeah. And you're right. And we sometimes do hear from people that don't understand that. They'll say, I was here first. Why am I not being seen? And to your point, it's often because of whatever the emergency situation is. Sometimes some people need to get back a little quicker.
Yeah, that's exactly right, Michelle. And a lot of that is based on what's the patient's complaint? What are their vital signs? How old is that patient? You know, somebody that's 75 that comes in with chest pain, we're probably going to get back before somebody that's 25 with chest pain.
Right.
But again, some things are time dependent. If we think you might be having a stroke, you'll come straight back. If you stubbed your toe or sprained your ankle, well, you're probably going to be okay and can wait and let that other person that has a more acute presentation be seen first.
And of course, at the same time that we're having people present through, coming through the doors and they're in the waiting room, we're also having the ambulances come in through the back. So you're having patients come from both ways.
Yes, and that's not visible to people who are in the waiting room. We're very blessed that we have such a robust EMS system here in Williamson County, but they do over 20,000 calls a year, and not every one of those comes to our hospital, but it's not uncommon to have 5 or 6 ambulances arrive within 5 or 10 minutes of each other. And so even though the waiting room might seem fairly empty, there could be several really acute, really sick patients who have come in by ambulance within the last few minutes, and that's requiring a lot of resources immediately.
Yeah. So what are some of the common conditions or symptoms, illnesses that you're seeing come through the emergency department?
Well, we see a little bit of everything. Again, that's what drew me to the ER. And there is a little bit of seasonal variation depending on if it's flu season, and we see lots of respiratory illnesses. During the first few weeks of spring, we see lots of minor trauma, lots of kids on skateboards or people out playing pickleball or hiking or doing yard work. We see some of that this time of year. There's always some sort of stomach bug going around with lots of vomiting and diarrhea. This time of year, again, there's lots of allergies, and we have the stuff that we see every day: high blood pressure, high blood sugar, chest pain, headaches, that sort of thing that we see year round.
And so you've talked a lot about liking the kind of unpredictability, that no 2 days are ever the same. Is there something about emergency medicine that still fascinates you?
Well, the fascinating thing, again, is the variability. Again, you have to be prepared for anything at any time. So you can never be complacent when you're there. I never think that I know how this day is going to go. I think it'll be a slow day or a busy day. You just go in and you're ready to work. You're ready to see whatever comes through the door next. Sometimes that's a major trauma. Sometimes that's a heart attack victim. Sometimes that's delivering a baby. And you just have to be ready to roll with the punches and take care of what needs to be taken care of.
How do you balance that? Like the crisis that literally could come in the door at any moment versus the other patients that you're needing to see as well. Like how do you balance that from minute to minute?
Well, a lot of that just goes back to our training. We spend so much time in emergency departments during school and during training. I always tell young medical students and residents, the number one question we have to answer immediately is this patient sick or are they not sick? Okay. And again, that's a combination of looking at the patient as they're walking back to the room or being wheeled back to the room. I'm taking on how are they breathing? What's their color look like? So every room I walk into, my first thought is what is the worst thing that your chief complaint could lead to a diagnosis of?
Yeah, and take care of that first. Yeah. I love that you said in medical school they taught us, is this patient sick or not sick? Have you encountered situations where you've thought to yourself, wow, they didn't teach us this in medical school?
Yes, yeah. And especially in the ER. Again, some of the stories that I could tell you, this might not be the proper form for some of those,
right.
But it's amazing the injuries that people can sustain and the mechanisms by which they can sustain those injuries. It's stuff that you would never think about, but at the same time, I have to be able to put that information aside,
right.
Focus on what's going on with the patient from a physiological standpoint, and take care of whatever injury that is.
Right. You can't be shocked by whatever it is coming through the door. You're just assessing and
exactly
taking care of it. Yeah. And what about, I'm fascinated thinking about when you physicians were in med school. So when you were a medical student and when you, let's say, had your first day in the emergency department, do you remember that? Like, was it wild to think of that you're here taking care of these emergencies?
I do. I remember being in the medical center in Johnson City with Dr. Gillespie, who was my preceptor for that rotation. I remember a couple of the patients from that specific shift. I remember, the first time I had to do CPR on somebody. Well, the first time we got somebody back from a cardiac arrest, or I remember the first time that we didn't get somebody back from a cardiac arrest, delivering babies or making a great diagnosis or something like that. Those are the things that stick with me the most.
Yeah, I bet. So what is the most challenging part of emergency medicine that people might not know?
I think the hardest part from my perspective is the hours that we work. The ER never closes. So every day is just another day. Holidays, weekends, they're all the same to an ER physician. We work a lot of nights. So everybody in that ER, we've missed our kids' sporting events or school events at times. I've missed my spouse's birthday on an occasion or so, which I hate to admit. But those sorts of things, we have to be here 24 hours a day, 7 days a week, 365 days a year. And somebody has to sacrifice to do that. So I think that's probably the hardest thing from my perspective. The other thing is the emotional toll that goes along with this. Again, it's a very high stress job where we literally are making life and death decisions throughout every day we're there. It's physically demanding work where you're working long hours. There's not a lot of time to rest. It's very uncommon that I get more than a 5-minute break to go eat lunch just because the patients are always there. But at the end of the day, you're physically tired, you're emotionally tired, and it creates a lot of stress on the providers.
Yeah. I know I speak for the rest of the community when I say we are so grateful to y'all because I cannot imagine the burden that is to bear every night when you go home. So thank you for all that you and your colleagues do.
Thank you for acknowledging that.
So is there a misconception about emergency medicine or maybe the emergency department that you'd like to clear up for folks?
Well, we're always prepared to take care of any patient that walks through the door with any complaint. Probably the biggest misconception is that patients think that we're always going to find a diagnosis and have an explanation for what's bothering them in that day. Again, my perspective as an ER physician is let me rule out the life-threatening emergencies while you're here. And if we can do that, and I think you're safe for discharge and you can follow up with your primary care doctor, then we can let you go home you can follow up with your doctor, and they can kind of take it from there and see what other tests need to be done. But it's very common that we will not find a formal diagnosis for your chest pain or your abdominal pain or whatever might have brought you in that day.
You stabilize and take care of the emergency before you. Yeah. So I have to ask you, are you watching The Pit? And if so, what do you think about it?
I have watched a couple of episodes. I've not seen all of them. I don't watch many of the medical dramas, but everybody said this one was so good, and I do think it's the most realistic one that I've seen.
Okay, I'm hearing that.
I think they do get a lot of the storylines correct. A lot of the medicine is correct. They might over-dramatize it a little bit. Again, they do a great job of focusing on the sick patients, and again, we get sick patients here, but it's not every single person is dying if the doctor's not there right at that minute. It's very rare that I'm running out to meet an ambulance like they do on the TV shows very frequently.
Okay.
On some of those shows, you have one person who's doing brain surgery on a patient, and they're doing an appendicitis on another patient.
Right.
And you have the specialists that would come down and do that.
Right.
So again, the ER, you're stabilizing them and you're calling those people. And that's probably the main thing that's a little bit different. But again, I think that does a great job of showing the emotional stress of what the ER is like, how chaotic it can be at times. Though again, it's usually not like that 24 hours a day. Some of the other issues that are on that show that are accurate, I think, are the mental health crisis. That's really been building for the last 10 years, but really peaked coming out of COVID. In our new emergency department, we have an area that's specifically designed to keep our mental health patients more comfortable. Those patients, especially if they have to be there for more than a few hours, can become agitated, and that's not always the safest thing for our staff. We have security down there just like they do on TV, and that's unfortunately a real world problem. Other issues that I've seen on there are concerns about cyber warfare. That's something we're preparing for. We've taken lots of steps to try and prevent any sort of cyber attack, but unfortunately that's a legitimate concern that every hospital is concerned, not just us.
Right.
Another storyline would be hospital diversion. That's something that happens not infrequently, especially as with the growth of Metro Nashville area. All the hospitals are busy, and so at times those hospitals are full, and those patients get diverted to us.
Yeah. And another thing I love seeing on the show that I know 100% happens here is the collaboration and the teamwork amongst the different departments. So when the EMS crew is bringing a patient in, or even the security team is coming in to the emergency department to work with the staff, I love seeing how everybody is excited to see one another and works together.
It really is like a jigsaw puzzle, and the pieces have to fit together well, and we're very blessed that we work together very well across the hospital. Especially with our EMS, which again, we're talking to those medics from the field. They're calling us about every patient. They'll send us EKGs. They'll call us if they have a question about what to do out in the field. And then when the patients arrive in the ER, if I need a cardiologist or a general surgeon or a neurologist, they're always readily available and can come to the emergency department to help at any time.
Right.
So yeah, we're very lucky that we've got such a dedicated medical staff that is here for the community and for the patients.
Yeah. A great example of that collaboration. We just recently released a new video where the EMS team, the emergency department, and the cath lab, all three of those teams came together for a training exercise, something that, we're routinely doing. And so they were running a simulation of a cardiac arrest. And so we got to kind of ride along and film that. And so it kind of seems like our own little mini episode of a show like The Pit. We're getting to follow and see what it looks like when a patient might be going into cardiac arrest, and what happens from the emergency EMS response to the ED to the cath lab.
Yeah, and that's a great example of teamwork throughout the hospital. We are an accredited primary heart attack ready center, and that entails all of those groups that you mentioned working together. Again, a lot of that happens before the patient even arrives at the hospital or in the emergency department. It's communication between not only the EMS and the ER, but it's not uncommon that I will contact the cardiologist in the cath lab before the patient is even there to let them know that we have a patient coming in having a heart attack, and we need to mobilize those resources as quickly as possible.
Yeah. So some people might hear us sometimes say that the emergency room is the front door to the hospital. What does that mean?
We admit between 20 and 25% of the patients that come through the ER every day. So at any one time, probably 70+ percent of the patients in the hospital have come through the ER.
Okay.
Also, a lot of people, especially the younger healthy crew in the community, might not need a lot of medical care, but when they come to the ER, that's their first exposure to the hospital. And so they come in, and if they have a great experience while they're in the ER, they might want to come back and get the rest of their medical care here.
So it's their entrance into the hospital. That's why we say that. So is there something that might surprise people if they could kind of peek behind the curtain, behind the scenes at the emergency department?
I think from a patient perspective, especially if a patient's waiting in the waiting room, the thing that would surprise them if they were in the back, just a fly on the wall, would be the number of ambulance patients that we get every day. Again, it's not uncommon to get 25 to 30 EMS patients every day. And again, if you're in the waiting room, you don't see those patients coming in the back of the emergency department. Other thing that I think would surprise patients is to realize that that patient is having a very bad day to need the emergency department at all. But then when you get back into the ER and you realize there are 42 other beds that have patients that are also having one of the worst days of their lives, a lot of times that helps put things in perspective. Nobody comes to the ER as a patient because they want to be there. So it's a bad day for everybody if you're in the ER.
Yeah, that's a good point. Yeah. So I would assume practicing emergency medicine often requires you to make very quick decisions, maybe sometimes with limited information. How do you approach those patients in those situations?
Well, and I think it's one of the main things that separates emergency medicine from other fields of medicine is, we don't have a long-term relationship with that patient. And a lot of times we have very little information at all, but we have to make those very quick and very important decisions. So even though, again, it's very high stress, we don't have a lot of information, we're going based on what is the worst possible outcome here, and let's rule that out the quickest.
Yeah. So when should a patient come to the emergency department? And I know we've already talked about calling 911. So if it's a life-threatening situation, call 911. But other than that, when should someone bring themselves to the emergency department?
Now, there's no right or wrong answer to that question. Everybody's different. And I always tell patients, only the patient having the emergency can define an emergency. Some people, it might be you have a bone sticking out of your arm and that's an emergency. Other people think my back's been hurting for 6 months and that's an emergency. And if they're in that much pain, it probably is an emergency. So I tell people never be afraid or ashamed or embarrassed to come to the ER. Again, we are here 24 hours a day, 7 days a week, because not every other clinic is available. So we're available for anything, however trivial you might think it is, we're prepared to handle that.
Right. You're never embarrassed to see anybody. You're never wishing somebody didn't come in. If somebody's wondering or if they're dealing with something that it just doesn't seem right, go ahead and come to the emergency room.
Exactly. And I get at least one patient a day who comes in and says, oh, I'm embarrassed, I didn't wash my hair, or I have on dirty socks. And I always tell them, I promise you we've seen worse, and they have nothing to be embarrassed or ashamed about. The main thing is that they get the care that they need wherever that is, in the emergency department or their primary care office. If people are unsure, I usually recommend call your primary care doctor first. They might be able to give you advice or maybe see you in the clinic. And if they hear the story, think you need the ER, they can give you some good advice from somebody that you trust.
That's good. So in this information age that we're living in and all these AI tools that are now coming out, what do you say about somebody who takes to the internet to Google symptoms or to ask advice? Those
tools are getting better, but they're still not the perfect answer. If you have symptoms and put them into ChatGPT or Google, that's great. That's going to give you some information, but I would still recommend you bring that information with you, but rely on the providers there, the professionals who do this for a living, to try and put those pieces together. And that information you receive is a piece of the puzzle, but it might not be the full solution.
And I bet you hear that a lot from patients, like, well, Google told me.
I get that from multiple patients every day. And again, I would Google symptoms if I were not in the medical profession as well. But again, if that tells you might need test X, Y, or Z, come to the ER and ask the doctor if you need that. Don't say, well, ChatGPT tells me that's what I need. You might, but you might not. Yeah. But don't get upset with the doctor if the doctor who has years of schooling and experience thinks differently than ChatGPT.
So I would assume that many of the patients we see, and probably their family members, are overwhelmed, often nervous when they come to the emergency room. How do you and your team bring a sense of calm and reassurance?
Well, you're right. And as we mentioned earlier, every patient's coming in, it's a bad day for them. So it is a very stressful situation. I've always been very much of the mindset that I need to be the calmest person in the room. I always think if I'm on an airplane and there's lots of turbulence, I don't want to see the pilot running up and down the aisle screaming that they're bouncing around. He needs to be calm and feel like he's in control, and that puts everybody at ease. Same way, not just with myself, but the rest of the medical staff. But I think a lot of family members of the ER staff would tell you that people that work in the ER just are not very excitable. Nothing gets them too riled up because they're constantly in a stressful situation at work, and they learn to mask that during the middle of a stressful situation and then process it after the fact.
Yeah. So we are so proud of the care that we're offering all throughout Williamson Health. How do you see that reflected in the emergency department?
Well, I think a lot of it is the smaller feel of the hospital, even though, again, we're up to 43 beds in our ER, seeing well over 50,000 patients a year. More shifts than not when I'm working, I will know one of the patients. Either I know them from the community, they live in my neighborhood, or I go to church with them, or I see them on the golf course, or I've seen them in the ER before, just from being here for so long. A lot of our staff has been here as long as I have been. And again, I think just due to the stability of the staff in the ER, that helps develop those long-term relationships. And again, I think that breeds more comfort for the patient. And I think it makes an overall patient experience much, much better.
So what would you say is the most rewarding part of your job? And I'm going to ask you from the emergency physician side and then also from the chief medical officer side.
The difference I can make in those patients' lives at that time. Again, you come in with whatever injury or whatever illness, hopefully I can make a positive difference for you right away. And the thing that ER misses is the long-term relationships with patients, but I love being able to make a difference for that patient at that time. That's by far the biggest reward when I'm working in the ER. From a CMO and administrative perspective, I think the big thing, again, it's what can I do to make the patients better or make their experience better. It's hard for me to necessarily feel those rewards in real time like I do in the ER. But over time, as I see that we've enacted policies that are helping the entire health system or the entire community, that's very rewarding as well.
That's good. Well, thank you so much for being here with me today. This has been very exciting. I knew it would be. And we greatly appreciate everything that you and the rest of the emergency department providers are doing.
Well, thank you. This has been a lot of fun.
Yeah, good.